Hey folks, and welcome back to the second episode of the recent vlog series that I'm doing on being a PA in orthopedics. This is based on a recent blog post I did on the website basicsofOrtho.com, and the title of that was Physician Assistants in Orthopedics, What We Do and How to Become One. In the first segment of this series, I answered the question, what motivates people or PAs to become a physician assistant in orthopedics. And in this next series or next episode, I'm going to answer the question, what do PAs in orthopedics do? So let's jump right into that. Physician assistants in orthopedics have the potential to fill many different roles in the orthopedic healthcare team under the direction of the supervising orthopedic surgeon. And these duties can be carried out in a number of different settings. They can be in the clinic, in the hospital, in the OR, and then in the last 5 to 10 years, the orthopedic urgent care setting. Many experienced PAs in orthopedics can function rather independently, but what do we do exactly depends on what setting you're in. So PAs functioning in the clinic setting, their duties can vary quite a bit depending on what it is that their supervising physician or surgeon does. There are many different subspecialties within orthopedics. A lot of people do just general, which is a smattering of it all. That's what I do now, haven't always. But PAs have the potential to work just with spine, with foot and ankle, with hand and wrist, with shoulder, elbow, with pediatrics, orthopedic trauma, or simply doing just total joint reconstructions. And there's also sports medicine, which I've done in the past. So there's a lot of different subspecialties that a PA can work in, and what the PA does in the clinic depends on what the supervising surgeon does. But in general, office responsibilities for PAs includes evaluating new and follow-up patients. They can order and interpret imaging studies, prescribe medications, braces, orthotics, physical therapy, occupational therapy. In some instances, especially in acute care clinics or urgent care clinics, you may do a fair amount of fracture or dislocation reductions. You'll do a lot of casting and splinting. You can perform a lot of aspirations and injections. There's some wound care in there, suturing, and then you'll also do some of the boring stuff, preoperative and postoperative exams. As far as how PAs work and do those things, a lot of PAs, in my experience, most PAs, at least in my location, have their own clinic and see their own patients. I do know of others that share a schedule with their supervising physician. They work off the same schedule. I mentioned earlier in the last 10 years or so, the orthopedic urgent care clinics have popped up, and PAs are largely staffed with or tasked with staffing those. And in those settings, as I mentioned, you'll do a lot more acute care work, focusing on initial injury evaluation and initial injury treatment, and then having them follow up with other PAs in the clinic for follow-up care and continued management. So that's our clinic setting. PAs in the hospital setting, they have similar duties, but most of the time the PAs in the hospital setting are tasked with managing postoperative patients. Once they get to the floor, those PAs are tasked with managing any issues that may arise after surgery. And to do that, that can include tasks such as ordering and interpreting diagnostic and laboratory studies, ordering prescription medications, ordering any type of brace or orthotics. There's a lot of paperwork in hospital PAs jobs, particularly admission and discharge notes and orders. Other hospital tasks that may fall on the PA in the hospital setting are doing ER or inpatient consults from other services. As a whole, there aren't a ton of PAs that do solely hospital orthopedics. There are some, but in my experience, not a tremendous amount. The third location that PAs work in within orthopedics is the operating room. And a lot of PAs really like this. I really liked it early on. The older I've gotten, I tend to prefer more clinic. But in the operating room, a PA can be very valuable to a surgeon. Once a PA and a surgeon team become really comfortable with each other, and that PA learns the surgeon's nuances, they can really become their second pair of hands and know what's going to take place and go ahead and initiate that getting done before it's necessary. So a lot of PAs like working in the OR settings. And depending on how much a PA does in the OR, a lot of that is determined by the surgeon. A lot of it is determined by the facility as well as state government. There can be regulations as to what they allow a PA to do in the operating room. But in general, of course, there's assisting. There's a lot of surgical wound closures, post-operative dressing applications, and a lot of splinting and casting. So those are our three main work settings in orthopedics. So the clinic, the hospital, and the OR. And as I mentioned earlier, most PAs, especially that I'm familiar with, they do a little bit of all of that. For me personally, I get up first thing in the morning, I go to the hospital to round. If it's a clinic day, I head to clinic after rounding. If it's an OR day, I head down to the OR after rounding. May have some discharges to do throughout the day. May have some hospital consults to do or ER consults. So depending on the day, it can be a big mix of all of those. So with that, I do believe that answers that second question from the blog. What do PAs in orthopedics do? I hope you have found value from this, and if you're thinking about getting into orthopedics, this helps you out. The third installation of this video series will be coming soon, and that's going to be what are the pros and what are the cons of being a PA in orthopedics. I'll see you then.